Okay, so exercise in pregnancy. So it's always much, the questions asked by the patients are by concerned patients. And once somebody's pregnant, they want to be doing everything absolutely the right way. So the American College of Obstetricians and Gynecologists have drawn up guidelines, and the doctor that you attend, be it the GP or your consultant or your chartered physiotherapist, or even your exercise instructor, should be aware of these guidelines. And the guidelines in general will state that it is a good idea to exercise in pregnancy. And the amount of time that you should exercise for is about 30 minutes, and anything from 5 times a week to 7 times a week. And the amount of the exertion for exercise it's described as that it should be moderate. And moderate means that when you're exerting, when you're doing whatever type of exercise it is, that you can continue to talk at the same time. Okay, that you can talk and that you're not short of breath. And it would be considered strenuous exercise if you were short of breath. So the benefits of exercise are obviously great. You are training muscle, you are building bone, and there is the benefits of the cardiovascular system, the respiratory system, and the general well-being and the social aspect of it. You will sleep better. There are also some studies and some thoughts that it might be better for your baby and neurologically better for your baby, and also some other thoughts that in labour that it is going to help with the labour outcome. So lots of good reasons for exercising, but you need to keep it safe. And part of the keeping it safe is making sure for you that exercise is the right type of exercise, and that you are going from non-pregnancy into pregnancy with and doing the right amount of exercise. So, for example, somebody who hasn't been exercising before, so that the non-exerciser, shouldn't start exercising at the beginning of pregnancy. And you shouldn't start because you just want to get over the first few weeks of your pregnancy without changing anything. Because as it is, what's going to be happening in pregnancy is there's going to be an increase in cardiovascular function. There's going to be an increased cardiac output. Now, what that means is the blood in your system is going to be increased by about 50%. So that's a lot of blood that the heart now has to cope with. And as a result of that, your respiratory rate is going to go up as well. So you've got all of these changes happening in your body in those first few weeks of pregnancy. And to start exercising on top of that, once you're not used to it, is not the best idea. So if you're a non-exerciser, it is possibly advisable, and you can discuss this with your doctor, but it's possibly advisable to wait until 13 weeks till that first trimester is over. And then to start exercising between sort of 5 and 10 minutes, 5, 10, 15 minutes, and increasing it up to the 30 minutes. And also that it should be a low impact exercise. So if you are already an exerciser, then it is perfectly safe to continue exercising once you don't have any obstetric or medical problems. Some of these contraindications would be, they can go under the headings of obstetric or medical, and the obstetric ones would be a previous history of miscarriage, which is not always a total contraindication but must be discussed with the doctor. Also what is called incompetence of the cervix, where there have been problems holding on to the pregnancy. Obviously if there's a lot of bleeding, if there's cramping, then that can be a problem too. So the medical contraindications then would be hypertension and diabetes that is uncontrolled. Asthma may be a problem, but that of course should be discussed with the GP as well, and perhaps just care taken there. The other aspect of exercising is that when you are exercising, the things that you need to be careful of are that you would need to look out for would be cramping, abdominal cramping, any vaginal bleeding, of course. Getting particularly short of breath. And the way to avoid obviously some of these problems, particularly getting short of breath, would be to make sure that you are not over-exercising and that you're not getting too warm and that you are staying very well hydrated. And getting too warm would be over-exerting, but also in the surroundings where you are. Perhaps gyms, sometimes if they're not well ventilated, can be too warm and there's a risk of getting dizzy. But certainly drinking a lot of water as you're going can help. So the type of exercise that you do is obviously important as well. And there are good types of exercise and bad types of exercise in pregnancy. So good would be walking, hiking, rowing, going to the gym, aerobics, continuing with your aerobics classes that you were doing. And the technique and how you walk is important. And it is important that you really use your walking. So brisk walking, you shouldn't be afraid to go for a brisk walk. And really moving your body, and if I can just demonstrate that your upper body should be moving on your lower body. So it's important that when you are walking, that you're not walking nervously and just loading down through your tummy and down through your pelvis the whole time. And that you get a good movement of your upper body on your lower body. So left shoulder and right hip come forwards at the same time. And you're not afraid to go for a good march out with your walking. So that really is the type of exercise that you can keep going all the way through your pregnancy. The bad type of exercise to do would be contact sports. So for example, squash obviously isn't going to be a good one, and any other type of hockey is going to be. So obviously just the speed of a flying ball through hockey is not going to be a good idea. Horse riding, and there are other more extreme sports that aren't a good idea either. So climbing in altitudes that are too high, scuba diving at all really isn't recommended, let alone altitudes that are too deep. One of our favourite type of exercises in terms of recommendation from your doctors as well is swimming. And swimming is going to be so good for you because of the effects that it has in water, that you are just supported by the water. You can increase what you are doing with the resistance and using the water as resistance rather than as support. But important would be that you don't do too much of the resistance work if you have any problems going on with your pelvis at all. The resistance and the kicking out, and this is often much known, the breaststroke sort of action, kicking out with the legs, where that can load up too much through the pelvis and can cause some problems at the pelvic joints. And the swimming is known to have a good diuretic effect in that if you have swelling at the hands and the feet, it is going to be, it will help to bring down that swelling. So the other types of exercises that are going to be very good for you too, it would be Pilates or yoga. Pilates will work on your core, on your center, and of course, given that your baby is being held in your core, in your center, this is going to be a good idea. And what Pilates will do, it will teach you how to control posturally your abdominal muscles and your pelvic floor muscles, and teach you good diaphragmatic breathing as well, so that you learn how to hold a good, strong center, and you learn through this how to move. So you're learning how to support your baby well. Similarly, yoga is going to be a low impact exercise. Similarly, you learn breathing, you learn stretching, you learn strength, you learn how to control your postures through stretching and through strength as well. So they are low impact exercises, and always it's important to know that your Pilates teacher and your yoga teacher are well qualified. In short, it's any type of these exercises, as I've mentioned under the good headings, are a good idea. And to exercise in pregnancy is a great idea for you to feel well and to be feeling like you're progressing, and throughout your pregnancy that you don't feel like you're getting more and more unfit. And certainly in the last 3 months you're not going to be able to exercise as much, and that's fine. But if you have been exercising throughout the rest of the pregnancy, you're probably going to feel like doing a little bit more in that last 3 months as well. So important is to make sure that you are talking to your GP, that you're talking to your consultant, you discuss this with them, and that you exercise under the guidance of your qualified exercise instructors or your chartered physiotherapist who you are attending either for your exercise classes or for any orthopaedic problems that you may have.